Everybody, Dr. Krenek here again at Bay City Chiropractic Center, and a question come up on what to do with low back pain. So I thought I'd deal with that today with you guys. And first of all, generally speaking, the studies show that about 1 in 4 people have back problems sometime within their lifetime. Interesting enough too, it's the #1 cause of emergency room visits for back pain, and it's one of the largest or most common reasons why that we miss work from our daily jobs. So it's a pretty important subject, so I want you to think about it seriously. So first of all, when a patient comes in, they usually have pain, of course, back pain, and where it can stem from is the disc, which I'll talk about in a minute. Very severe pain can come from a facet joint, can be muscle, tendon, ligament, and so what we do is we evaluate each individual part of the spine to see exactly what's causing it and what's going on. So I'm going to talk specifically about the disc issue because that's what most of us are familiar with. And the disc, of course, is the cushion in between each vertebrae, and that gives that flexibility factor, that little bounce in our step. So without that disc, we'd be very rigid, very impliable, and motion would be very difficult to achieve. So what we want to do is protect that little thing at all costs. It's composed of 2 structures. You have an outer, very tough part, and then an inner part that's kind of soft and jelly-like, and that's what tends to herniate and puts pressure on the nerve, and that's where you're going to feel it. So when people come in with the back pain, what we want to do first of all is we want to get them out of pain. So there's a couple of ways that we do that. First of all, of course, we recommend rest. We recommend ice, and there are some nutritionals that can really help you with that, such as Boswellia, turmeric, things of that nature. Quite a bit of relief with those products. Once we get the pain under control, we do what's called step 2, which is repair. And what that is, we start implementing a few stretches, some mild little forms of exercise to help get motion back inside the part. And as you feel better and better, then we go into what's called phase 3, which is strengthening, of course. And that's when we introduce the weights, heavier balance exercise, where my therapist works with you one-on-one to make sure you're building the structures properly. So, in a recap, what you want to do when you the first moment you feel back pain is you want to rest it and ice it. Of course, get it checked out to determine exactly what's going on. Second thing you want to do is start introducing a little bit of motion with some exercise, some stretch. And then the third thing, of course, is strengthening and build the structures around that area that's been injured. And then hopefully things will go very well for you. In advanced cases, say pain continues with you, we try a series of what we call conservative care. Things do not go quite the way we'd like. Then what we do is recommend advanced imaging, such as MRI, CT. In certain cases where possible infection would be bone scan, things of that nature. So the best thing to do is get a proper diagnosis, see what's going on, and then you can take it from there. So hopefully this has been helpful for you. If there's anything I can do for you or your family, my number is 979-245-6844. If you'd like to have any information sent to you regarding this, we can email it. We can do it via Facebook. Just however you'd like to receive the information, we'd be happy to do that. So always remember, this is Dr. Krenek here again. See us first for relief that lasts. Have a great day.